This is One-on-One. Dr. Mario Finkelstein is an addiction psychiatrist. Let's talk about addiction as an illness. Is it an illness as opposed to some sort of lifestyle choice people have? Clarify an illness.
Well, we have come a long way in trying to identify addiction as an illness, and there is absolutely no question that we are dealing with one of the most severe brain illnesses, lethal brain illnesses. Essentially, the whole process of the addiction is when the drugs or the alcohol modify the brain circuits to the point that the individual starts living in a way that is totally out of his control, and the brain circuits have been changed and probably forever.
Mm. Doctor, I'm curious about this. Some people become addicted to prescription pain medication. How do you differentiate that from what you just described? Say someone, we just had a physician in here who was talking about pain, chronic pain. Someone gets a prescription for a certain medication to deal with their pain. They get addicted to that pain medication. Is that different from what you just described?
That's an excellent question. I think it's very important that the addiction person be able to make that distinction. Essentially, when we talk about addiction, we're talking about a host of behaviors, a host of attitudes, a host of complications that will contribute to the diagnosis of the addiction.
For example?
For example, there are behaviors in which the individual's private personal life changes and their priorities change dramatically. Obtaining the drug it becomes the primary purpose of their day. This, as you can imagine, brings significant complications at the social, in his social environment, in his professional environment, and in spite of all these complications, one of the characteristics of this illness is that it's out of control, so the individual is unable to stop by himself, and they continue to use in spite of in very risky situations while driving, while operating machinery. They continue to put themselves in positions of high level of risk. I always use the example that nobody drinks themselves to cirrhosis of the liver because they want to. Nobody gets HIV because they want to. Nobody develops hepatitis C because they want to. Nobody dies of an overdose or drives under the influence because they want to. So one of the characteristics of the illness of addiction is the loss of control, and due to the effects of the drugs or the alcohol on the brain. On the other hand...
By the way, as you're speaking, Doctor, we're putting up important information about websites and organizations that we have partnered with for you to get additional information about what the doctor's talking about. I'm sorry, Doctor, pick it up.
The point that you brought up in terms of individuals being prescribed medications, for instance, for chronic pain or for cancer pain, being prescribed narcotics. First of all, these medications are being prescribed. There is a legitimate purpose for the prescription of this medication, and it is very possible that that individual taking for a prolonged period of time those medications will develop some symptoms of tolerance and some symptoms of withdrawal if they manage to stop. Those are two very important symptoms, but in an individual who has the illness of addiction, they are part of the definition. In an individual who's taking a legitimate medication for a legitimate purpose, by itself, they do not describe addiction by any means. The patient may develop tolerance, the patient may develop withdrawal symptoms when they stop the medication, but by definition, that's not an addiction.
I want to be clear on something. The New Jersey Prescription Monitoring Program is a powerful tool to help physicians do what?
It's a powerful tool. First of all, we're talking about, we need to clarify this issue because very often it's it's misunderstood. We're talking about patient's safety.
Well, what is it? So a patient goes and tries to get a certain kind of drug from a physician, and that physician, through this program, this monitoring program, does what?
You have access through your computer to this website in which there is very important information about this individual. You enter his information, and then you get information about what medications, particularly narcotics, he's taking. Mostly narcotics or what we call controlled dangerous substances.
That's what we're concerned about, controlled dangerous substances. Go ahead.
The ones that this individual is taking, who is prescribing them, what is the amount, and who is dispensing this medication.
What the history is.
What the history is.
And shouldn't this help the physician deal appropriately with that patient?
It helps the physician deal appropriately because you can identify if this individual's safety is at risk because he's obtaining medication from different providers, but also can identify providers who are not practicing according to the standards.
Well, shouldn't every physician be using it?
Every physician should be involved in
Is
this
every
program.
physician, are most physicians using it?
The last statistics that I reviewed were that about 40 to 50% of the physicians and pharmacists were involved.
It's not enough, is it, doctor?
So far it has been voluntary. We, the practitioners, have been encouraged to participate in this program, and it's not sufficient.
It's not, is it?
It is not.
We need to do more?
And the program, it also has its drawbacks. It's not 100%.
Well, we need to improve it, but we need
Absolutely.
greater participation.
Absolutely.
And this addiction issue affects all of us. And I want to thank you, Dr. Finkelstein, who is an addiction psychiatrist. We also had the websites of our colleagues and friends who are working on this issue every day. I want to thank you very much, Doctor, for joining us and shedding important light on addiction and letting people know it is a serious illness. Thank you, Doctor.
Thank you.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by the New Jersey Education Association, Wells Fargo, activists in cooperation with the American Medicine Chess Challenge, Steve and Elaine Pozicki, United Water, MagnaCare, and by Johnson & Johnson. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.